You have a lot of great networks and
people
experience.
know that. They know what they're doing. They just tell me what to do.
Or you find people to help you with what you do as well. But then again, we could bring a lot of help in some of the management, right? In terms of who have done this before and everything else. And going back to the previous gentleman's point with the breast cancer, we invested also in a similar company, decision-making process for physician, and started at Duke as well. We invested $25 million. 17 of that came from our own money. We've gone through a lot of learning lessons. Unfortunately, it didn't work because reimbursement was an issue, regulatory hurdles. We decided to call it quits. Then we sold it to McKesson for peanuts. We had an exit, but not the multiple that we wanted. But then again, the point is, a lot of VC firms have these tombstones. We don't like to talk about it, but we learned a lot from it. Hopefully, we'll take that and help entrepreneurs get to that inflection point. Also, because as an experienced CEO who sold this company to McKesson, but maybe not necessarily at the right multiple, he didn't make well. It was a financial gain, but he learned a lot. It would be a great support to you taking that as well. So think about venture capital. Obviously, some of the angels do bring early seed investment, but that might not be the people to help you find the right management team and everything else. For VCs, for expensive as it is, we do bring a lot to the table to support the entrepreneurs succeed.
Thank you. Thank you.
Other questions before we go to Mike?
I just wanted to ask about, you were talking about consumers and consumer apps and how there's this huge potential market for consumer apps. Do you know of anybody who's dealing, because obviously within those consumers there's sick people and they're highly motivated, but there's the millions of people who need to change their lifestyle in some way, and the app may be interesting, but these people have a history of whatever it is, their behavior. Is there anything out there that you know of that deals with the issue around actually changing behavior, like or patient activation, that addresses that?
Can I say something? I think you could be a great venture capitalist. I'll tell you why. Because they're great apps that empower patients, learn more on pedometers, whatever it may be, give a lot of data. But what does it lead to? It doesn't lead to behavioral change, therapeutics, drugs, and anything else, right? So I think that's the right combination of the companies we need. That's the problem with us. We see a lot of great companies with great data sets. So what? And especially I wear my paternalistic medical doctor hat, and I said, well, how does it lead to what we could do to make money, right? Patients bring me all this data, so what? What can I do, prescribe, or any procedures that can help me make money at the hospital side or from the investor side? How do we monetize the data? If we can't do it, it's not going to work. So I think that's one thing that we will suggest, as you suggested. Those type of companies will succeed by natural selection because we're not going to fund a company that just gives you data and you can't do anything with it. So I think there's been a shift, and thankfully in the last 3 years we've been looking in this space. A lot of companies have figured this out. Great app, but so what? They're going to get to the next inflection point. And you're seeing that, but not enough.
Great.
I just wanted to make a comment about Avatar. So the VA is using Avatar. One of the things they're doing is trying to make that shift between just punching in information and then making the change. And so they're using avatars for patients around PSD. So that may be something to read. Not that that's the solution, but I think that's the only thing I've heard in that area.
Mike?
This question.
I just want to make one comment, and this is a little bit self-serving, but we're getting, it's great that we have so many visitors from off of UCSF campus. I just want to highlight that a lot of the questions that I'm hearing, there is activity on campus where our innovators are working on these problems, thinking about what you are asking about, consumer-facing apps, mindfulness apps, cognitive behavioral therapy. And really what I want you guys to understand is that we are interested to find partners to help our innovations leave. And in digital health, the barrier for entry and exit is a little bit lower, and I would really, really like you guys to understand it. You have partners on campus that would want to talk to you to figure out how you can engage with our PIs, our clinicians, our scientists. And Opinder is one, Jeff is one, Ed in the back is one, I am one. So please come talk to us if you want to figure out how to connect with us. I will stop.
No, thank you, because I really was going to end on that note. Is just, please actually connect with Jeff and to him, because I think they're just a wealth of information, and they know exactly what we are all up to, and what we think we need, and how we can partner together on various initiatives. So please do that.
One more question.
All right, Mike, you get the last one.
All right, great. You mentioned predictive analytics, and I just wanted to give you guys an idea of kind of where we sit a little bit, you know. What we're noticing inside of at least UC Davis, we're going to see, I'm sure it's happening here, and that is this idea of secondary use of EHR data, whether it can be used or not. Sometimes it can't be, it's not granular enough, but one of the things, if it's tied to reimbursement, there's just a few things that motivate change in healthcare in America, and that's one. Okay? So when you're looking at a strategy around how to be successful, if you can make that part of your business model, that's a good one to pick. And I'll just give you an idea. We actually selected a technology to help us assemble data and then provide it directly back to our care providers on the floor around sepsis. So these are patients who get very sick from infection. And if you don't catch that early on and intervene, it can be a very bad outcome for them. And when you look at length of stay, which equals lots of money, okay? If you can shorten the length of stay even one day, you're talking a lot of money. And finding a sepsis patient early on might actually allow you to shorten their stay by maybe 5 or 6 days. Even maybe avoid an ICU stay and that kind of thing. So that's become the #1 priority. It is sort of shrouded in this thing called the Sepsis Collaborative, but it really is driven by money because we're at risk. Well, we agreed to be part of a program with CMS, the biggest payer of healthcare in America probably, and what they're really interested in is that it pay for performance, but they're not really calling it that, because that has some negative connotation, but clearly we're at risk now. They told us we got $150 million if we can prove that we are adhering to a certain bundle of things that happen to a sepsis patient after they're identified. And if we can show that data-wise, we get 140. Now that might not sound like a lot of money when it's $500 million, but for UC Davis, $140 million is a lot of money. Okay, and we see this not just happening in sepsis. CMS is clearly looking at this as a way of cutting costs because the Affordable Care Act, if you look at the data, will definitely cover more people. It will not reduce total costs, okay, at least for the first 10 years. So there's a huge bill to pay still. And so this is a maneuver to try to do that while improving value and quality, because healthcare has a lot of space, a lot of dead space. I hate to say that word there. So if you can do that, if you have something that provides value there, it's amazing. And the secondary use of data, there's EHRs galore. Find me a company who can take EHR data and produce something of value that improves quality of care, reduces costs, and makes CMS happy so that we get our $140 million. You've got magic. So just realize that's one of those sort of hidden things that's happening right now. You don't see it. It's not really EHR related. It's after the EHR. And it shouldn't surprise you that now Epic has announced they're going to have a data warehouse that will take more data than just Epic's.
That's correct.
You can't do this kind of thing with just EHR data. You've got to get it from lots of different pots. And so Epic decided we're now going to open ourselves up and allow other data to be put into our data warehouse. Very clever. Okay, so just an idea for those who want to kind of be successful in the next 5 years or so in this space.
Thank you.
Thank you.
Thank you very much.
Thank you.